work was certainly catalyzed by the federal and state Family First Prevention Services Act and Family First Prevention Services Program. As part of our planning, we've chosen to go beyond any specific funding stream and really focus on the broader goal of connecting families to services and supports regardless of their eligibility for a specific funding stream. So our work on the community pathway is inclusive of FFPS and FFPSA, and we have gone beyond that to really extend services to families where they need them. So the way that we've started to implement this work, and the first phase of our work, which we sometimes fondly refer to as 1.0, was to create a county-wide implementation work group for the community pathway. And this first phase of work was led by First 5 LA, so our county First 5 Commission, the Office of Child Protection, and our County Department of Children and Family Services. We really tried to reach a broad swath of partners. So it was composed of systems partners, community members with lived expertise, and also representation from community-based organizations, tribal and institutional leaders. So the first phase of this work was really focused on advising on state block grant funded projects, improving service access and navigation, providing a venue for problem solving, information sharing and relationship building, and facilitating alignment between state and local efforts. And Dr. McCroskey will be sharing a little bit more about that later on in terms of what we learned from this first phase. Now we'd like to engage you as the audience. I am going to pull up the Mentimeter. If you would like to use your phone or your computer, you can go to menti.com, and the code is 96299962. Reshare my screen. Thank you, Min. So our first question is your jurisdiction implementing a community pathway? So yes, no, or maybe you're not sure. A lot of yeses so far. This is great. Responses are still coming in. So the majority. Looks like the responses are slowing a bit. So yes, the vast majority of your jurisdictions are implementing a community pathway, which sets us up well for this next question, which is, if yes, which of the following elements are you working on? So we just chose some that we hope are relevant to other jurisdictions. So you can choose multiple options. Capacity of programs. Fiscal sustainability. Okay, great. It looks like a lot of you are working on these elements. If we don't have time to come off mute at this point and share, but if you'd like to share anything in the chat in kind of response to this, how you chose maybe which elements to work on, and maybe which you chose not to, or are there other elements that we didn't include here that you'd want to highlight? Our next question is whether you are partnering with any of the following. So again, we thought of a few examples: schools, community-based organizations, childcare, hospitals, but also have this other category. And again, I'd invite you in the chat to share, especially if you selected the other category, who you're partnering with so that we can capture that. A lot of CBOs, schools, great. Okay, great. So a lot of CBOs, but across the board, it looks like partnering with a lot of different types of providers, which is wonderful. And here's our last question. So in LA County, we are really exploring and valuing the notion of basic or concrete supports for families. I understand there was a session around that already today. And so we're curious if you're thinking about that as well through the community pathway. A lot of yeses already. Again, would invite you in the chat to share if there's specific basic or concrete supports you're looking at, and whether there's kind of any learnings you have from exploring those, and particularly exploring funding options for those. Could be FFPSA, could be the state block grant funding, could be Medi-Cal, could be any of those options. Great. All right. Well, thank you all so much for participating in that. And I'm already seeing some comments coming in through the chat, which is great. And we will go back to our PowerPoint, and then I will pass it to Jacqueline.
Yes, those Mentimeter responses were quite promising. So I think we can have a good conversation. I want to just give a little bit of an overview of what Anna referred to as 1.0. Basically, LA County started working about 2.5 years ago on our community pathway. So the summer of 2022. And at the end of last year, we published a report that sort of summarizes what we were able to do. We will get that report to anybody who's interested in finding out more. But so we essentially, what we did was we developed a number of pilot tests that were related to things that were already underway and to things that we thought were going to be particularly important for the community pathway. And over that period of time, developed what we called 4 essential strategies. There were 27 pilot tests. And so there's a wide array of things to talk about, but we thought it was really, really important today to talk about 2 of our strongest partnership initiatives. So just briefly, in terms of the strategies, the first one was strengthening public-private partnerships. As you know, a lot of this work proceeds from county government, and we wanted to make sure that not only within county government, across multiple departments, but with our private sector and with our community groups and resident groups, that we were making sure that we had the partnerships in place that went across sectors, and not just for the county, and that we also focused on community-based organizations, those that already are affiliated with county government, but some which are not. So we wanted to strengthen those partnerships and build the capacity of our community-based organizations. in the second strategy had to do with establishing new institutional partnerships, because while there's a lot of work that's been going on around prevention in LA County for quite a long time now, there's still some partnerships that really weren't in place. I'll give you one example. We have the nation's second largest school district, LA Unified School District, and there really wasn't a specific partnership between LA Unified and the County Department of Children and Family Services. So that's one of those that appears on the list of specific pilot tests under that strategy. The third one was bolstering existing promising initiatives. We're fortunate in our county. We've been working on these ideas for a very long time now, decades really, and we have a number of very promising initiatives, two of which you're going to hear about today. Plans of safe care and our county's mandated supporting initiative. And then the fourth strategy had to do with enhancing what was already in place, and making sure that there were a broader array of supports available for families already involved with our Department of Children and Family Services. So as I say, if you're interested, we can get you the full report. We will follow up on that with you. But at this moment, I think it makes the most sense to give as much time as we can to Minson Meeker, who's going to talk to us about plans of safe care. And then she can transfer it immediately to Tamara Hunter, who's going to talk about our county's mandated supporting initiative.
Thank you, Jacqueline. Hi, everyone. I'm Min with the Office of Child Protection. For those who are not familiar, the Office of Child Protection here in LA County, we are a separate agency from the Department of Children and Family Services. We were set up by our Board of Supervisors back in 2015 to lead multi-agency collaborations across child and family well-being, child welfare, priority areas, and we facilitate the system of care for children and youth here in LA County. I will be sharing some background information about our plans of safe care work here in LA County and how it aligns with the community pathways work, as well as other prevention and promotion efforts here in the county. I would love to know in the chat as I'm speaking if there are other counties here who have POSC protocols already in place or are starting to explore POSC, because we know there's a lot of jurisdictions. Different phases of implementation around POSC. Click, please, Anna. Thank you. So what is plan of safe care? Since the mid-1990s, state laws and federal legislation, both through the Child Abuse Prevention and Treatment Act, as well as the Comprehensive Addiction and Recovery Act, has required that counties maintain policies and procedures for addressing the needs of infants who are prenatally exposed to some substances, including the development of something called a plan of safe care. It also says that counties need to have procedures for making referrals to child welfare agencies by healthcare providers when necessary. Click, please. So California state laws are very clear that substance use in and of itself should not trigger a referral to the child welfare agency unless there is a child safety concern, and that healthcare providers should be conducting some sort of assessment of the newborn and family before consulting and or making a referral to the child welfare agency. Click, please. A POSC for us, as we've defined it here in LA County, and I think this is apparent in guidance from the federal government as well, is really a document that should be jointly created between a pregnant or parenting person, their family, and care providers, to really document the supports and services, resources they need in order to be safe and care for their baby safely in their home and assist with care coordination as needed. Next slide, please. So the goal of the POSC work here in LA County, click please, is really to ensure that pregnant people using substances and their infants who may be exposed to substances and their caregivers are assessed for needs and strengths as early and upstream as possible and referred and linked to community-based services. Click please. So while the federal and state laws around POSC state that the plan itself is required for substance-affected newborns, here in LA County, our work has really tried to move as upstream as possible and focus prenatally as well as on those substance-affected newborns. We want to identify those needs and strengths and support families as upstream as possible. We believe that's critical to increasing their protective factors, keeping children safely at home with their parents and out of the child welfare system. Dr. Hunter will talk more about the mandated supporting initiative, but our POSC efforts really align with meeting federal and state requirements. It aligns with a lot of the prevention and promotion priorities here in LA County around the mandated supporting initiative, the Prevention and Promotion Systems Governing Committee, and then also with the Family First Community Pathways goals. Next slide, please. I wanted to share a little bit about where we are in our implementation efforts. I actually just did a national SUD summit webinar with the state of Connecticut, where I think we compared our two approaches, where I think there's other jurisdictions that have taken a more top-down approach with legislation and clear guidance from the state. I think California and here in LA County, as jurisdictions who are counties who are implementing this now know, there's a little bit more of a bottom-up approach of developing some of the guidelines and protocols specifically in counties. Click, please. So OCP created a Plan of Safe Care work group back in 2021 when we received a grant from the state, from the Department of Healthcare Services, around the intersection of opioid use and the child welfare population. This was around the same time that we were starting to do work on Family First and Community Pathways implementation, so it aligned really nicely. We brought together partners that are listed here in many county departments, along with our partners from First 5 LA, court partners, as well as the National Center on Substance Abuse and Child Welfare and other stakeholders. A lot of what we discussed is that here in LA County, we didn't want the Plan of Safe Care process to be initiated or rooted in the child welfare system. We really wanted to move it upstream and create a pathway from some natural touch points for families, which are healthcare settings, hospital settings, so that they could initiate the Plans of Safe Care process in those settings and hopefully link and refer families to community-based supports through the hospital and healthcare system. We realized that this was, a new, I think, workflow and program for some, and that we needed to pilot the process before implementing it countywide or developing specific protocols for LA County. Next, click, please. So currently we are piloting our Plans of Safe Care protocol in 5 hospitals here in LA County. 3 are County Department of Health Services hospitals, LA General Medical Center, Harbor UCLA Medical Center, and Olive View UCLA Medical Center. And then the 2 other hospitals are private hospitals, St. Francis Medical Center and Adventist Health White Memorial. And I want to just highlight that the reasons we selected those hospitals, one, we really wanted to do this work with our County Department of Health Services to ensure that at least between the County Department of Health Services and DCFS, we had a county protocol in place. We also really wanted to partner with private hospitals to understand how we could work with their existing workflows and resources to build Plans of Safe Care processes into what they're already doing. We also picked these hospitals because there were champions there that really believed in this work, and they had some other resources or programs already in place that we felt aligned really nicely with our intent of Plans of Safe Care. So that includes at our Department of Health Services, we have a program called Mama's Neighborhood that identifies and works with high-risk pregnant people to provide free prenatal and postpartum healthcare services. So there are a lot of social workers and medical providers there through Mama's Neighborhood that are already trained and really believe in working to support families and address social determinants of health. And then several of the hospitals, including the private hospitals, also have the Welcome Baby program, which is a home visiting program funded by our First 5 LA partners at their hospital sites, along with substance use and housing navigators funded by other grants. Next slide, please. In terms of our, Anna, you could actually just click through so all the slides come up. Thank you, or the bullet points. So in terms of where we are with our implementation efforts, we actually are being funded by the state block grant here in LA County to work on capacity building and also to provide some direct service. So through our capacity building state block grant, we have brought on a consulting team who is working with us to provide technical assistance to the hospital pilot sites, and that includes training staff, refining workflows, and then providing implementation support. We've also provided outreach and education on POSC requirements to hospital and hospital settings through the 10 largest birthing hospitals here in LA County in partnership with the Hospital Association of Southern California. I think for us, one of the things we found pretty surprising is a lot of our hospital partners, especially medical social workers, were not aware of the state law that, you know, substance use in and of itself does not require a call to CPS. There were a lot of automatic calls to CPS anytime there was a positive, you know, toxicology screening or admission by the parent of substance use. So we're really training our hospital staff around, you don't need to call CPS automatically. You need to really pause and do an assessment of the newborn and figure out if there are other safety or risk factors. And then we are also researching fiscal sustainability options for POSC so that it can be maintained in terms of initiating the process within the healthcare and hospital settings, as well as looking at what other community-based supports are needed in terms of expansion and capacity building to support these families. We're also partnering with the LA County Mandated Supporting Initiative, which Dr. Hunter will talk more about next, to provide trainings and plans of safe care information on one website. And the link is here and I'll drop it in the chat when I'm done talking. And it includes all of our pilot workflow information, FAQs for staff in hospitals and DCFS and community-based organizations that are part of our pilot, the actual plan template itself, and all of the trainings that I mentioned, which are available online to anybody here who's interested. We created 10 webinar trainings that covers a whole host of issues related to plans of safe care requirements, as well as, you know, working with pregnant parenting people who are struggling with substance use. And then the most recent kind of update in our implementation efforts is that we partnered with Shields for Families, a community-based organization here in LA County. And I think I saw some Shields folks here in the room today. And we applied through a collaborative process for the Road to Resilience grant from the California Department of Social Services, OCAP, which is going to address funding navigators to be placed at hospital pilot sites to support the POSC efforts. And I will talk a little bit more about that in a minute. Next slide, please. I just wanted to share a couple of examples of some of the documents and policies that we've created or documentation we've created related to our POSC efforts. One thing is, again, we're really trying to drive home with our hospital partners that you don't make that automatic call to CPS when there's substance use, that they need to do an assessment of the newborn and caregiver to see if there are other safety or risk factors that may meet the threshold for calling CPS. So we actually worked with our Department of Children and Family Services, Child Protective Services leadership to create, to update a newborn risk assessment that the state had put out years ago, but it wasn't specific to substance use. So this NRA has been updated to be specific to substance-affected newborns, and our DCFS partners are the ones that helped us update the materials. And I will drop a link in the chat. This is just the first page. There's a couple pages, and there's also a matrix that shows kind of the different levels of risk. And it's based on what our hotline folks said that, you know, they would really be using to do their own assessments when calls come in. Next slide. And then these are just snapshots of our actual plans of safe care template. I want to give credit to Orange County, who I think is also in the room. We stole their name, Family Wellness Plan, for our plans of safe care template itself. We have been piloting POSC we've been piloting it since, I want to say, spring of 2024. We started at UCLA, Harbor UCLA as our first pilot site, and the template that we were using looked very different. It was called A Plan of Safe Care. It was kind of a boring government looking document that our social workers at the hospital sites and medical providers were talking with families about. I think one of the things we learned really quickly was that that was pretty intimidating for some families. So in the very beginning of the pilot, we had a lot of families declining to participate in terms of, you know, really being assessed for their needs and strengths and referred to services. So in the last 6 to 8 months, we've been doing a lot of work partnering with community-based organizations, lived experts, advocacy organizations to really make sure that the plan that we're sharing with families feels family centered and something that the family finds engaging and feel ownership over. So we've updated the name of the plan. So we're calling it a family wellness plan. And we've gone through and ensured that it's looking at strengths and supports that the family needs. Next slide, please. Along with some information on the baby that, this is something that some parents had brought up with us of having just all of the information in one spot. It's also really helpful for care coordination for pediatricians. And then we have a section in the family wellness plan around a whole continuum of resources and services that we felt could benefit the family. And then we're giving them the option as we're going through the planning process, like, are they already participating in these services? Would they like more information? Or would they like a referral and help with like a warm handoff to a provider? Next slide, please. And then Anna, you could just click through all the bullets. Thank you. Ooh. So as I mentioned, we're working with Shield for Families to place these hospital-based navigators at our 5 hospital sites. I think this is really critical for us as a next step in our implementation efforts. At the beginning of our pilot, it was primarily hospital staff, medical social workers that were working with families on creating the POSC. I think in some instances that was a little bit challenging and scary for families to have medical social workers talking with them about their substance use and their needs and documenting some of that information. So we heard, from a lot of partners about, potentially adding bandwidth at the hospital through navigators and other supports who could come to hospitals and really work in partnership with the hospital team, the providers and the social workers to initiate the POSC process. So we have this grant for 3 years. We are actually combining the state grant along with additional FFTA and state block grant funds so that we're able to place 6 navigators across the 5 hospital sites. And the navigators will be referring and connecting families through community pathways to a continuum of services. And just the one other thing I'll just share is that's really unique about this navigation program is that I think we're really lucky to have found a partner like Shields that already has so many other services that they have in place, whether that is, their cultural brokers program, their preventive legal services program, home visiting programs, so that really we can weave together those supports for families. And then the other thing is we wrote into the grant that the grant could fund concrete supports and engagement incentives for families that participate in our POSC process. Next slide, please. And then this is the last slide. Just wanted to share just some quick lessons learned. You can see all of the partners that are part of our POSC collaborative includes numerous county departments, First 5 LA, community-based organizations, and hospital partners. I think the biggest learnings for us to date is that while there's a lot of agreement from our healthcare and hospital partners around vision and intent, they need a lot of support around capacity building for implementation. And that's where, again, we brought in these navigators through Shield for Families. I also think hospital staff need support around mandated reporting, education, and training and support. And that's where our partnership with our mandated supporting initiative comes in. And then the last is that warm handoff to community-based resources and being able to close that referral loop is really key, not only for families, but for our hospital staff to feel confident that the family's needs are being met, and that really helps them, I think, allay some of their fears around reporting to CPS. And then the last thing I'll just share about growth is we're going to be piloting this with our hospital partners for the next couple of years, and then grow this to scale a protocol countywide here in LA County. And we've already been talking with partners about could we use similar processes in other settings, not just for pregnant parenting people who are struggling with substance use, but incarcerated parents, like homeless families, people struggling with intimate partner violence. So this is something we're continuing to look at with our partners. With that, I'm going to pass it over to Dr. Hunter to share more about MSI.
Thanks so much, Min, and good afternoon, everyone. Thank you for choosing to spend some time with us. Again, I am Tamara Hunter. I lead the county's Prevention and Promotion Committee and our work on mandated reporting reform. Next slide, please, Anna. Thank you. So given the wave of reform efforts efforts to reform mandated reporting of suspected child abuse and neglect that is sweeping our state and the nation. I won't spend much time overviewing the myriad reasons that mandated reporting is such a deeply flawed policy response to our responsibility as a society to ensure that children are free from harm. I'm going to assume that this group is well versed on the need for reform, which this slide highlights. And I won't go over it in great detail, except to say that what we are doing and in the way that we're doing it does not work for families and it does not work for mandated reporters. And I'll also add that there's no conclusive evidence that what we're doing in the way we're doing it actually advances child safety. Next slide, please. So LA County has been working to reform mandated reporting for a few years now, and we are doing it through a broad coalition of amazing leaders and change agents locally as well as throughout the state and across the nation. And the goals of LA County's reform effort are to prevent children from experiencing harm. That is the harm that is caused by child abuse and neglect, and the harm that is caused by involvement with the child welfare system. And we know that the best way to ensure that children are harm-free and safe is to ensure that their families are healthy and well in the broadest sense of those terms. We also want to do a better job of providing high-quality supportive services to families who are in need but who do not need child protective services. And we want to do so at the mandated reporter level. And finally, our goal is to eliminate mandated reporting as a driver of racial disproportionality in the child welfare system. And our model for transformation is four-pronged. It involves improving the training that mandated reporters receive, and most importantly, improving the quality of decisions that they make through use of decision support processes and decision support tools. Our model also involves building pathways for mandated reporters to easily connect families in need to supportive resources at their level, and I'll talk a little bit more about that in the next slides. Organizational and policy reform, as well as legislative advocacy, is another important pillar of our work. And finally, narrative change is critically important. It actually undergirds everything that we're doing. At the core, the work that's underway here in LA County is a narrative change effort. And a simple way to describe narrative is as the stories that are told, the stories that are heard, and the stories that are believed about a social issue, about those who are impacted by it, and about what is possible in terms of resolution. And so the narratives to which we subscribe, right, those stories that are heard, told, and believed about the families and communities that we serve often hold social problems in place. Next slide, please. So mental models are the ways in which we think about and understand and navigate the world. And when narrative change is successful, it reshapes our mental models. And so the most important narrative that we are trying to shift and disrupt in LA County's reform effort is the belief that what we are currently doing when it comes to mandated reporting, including all the harms of this policy, is somehow a necessary evil to keep children safe. We've come to believe that, and that's a fallacy because there is a better way. Next slide, please. Another really important shift in mental models that we are striving to usher in LA County has to do with the way that mandated reporters have been conditioned to believe that they only have two choices. So mandated reporting in its current iteration is a reactive policy response by design. Mandated reporters have been conditioned to believe that they have a binary choice. They either report or they do not report suspected abuse or neglect that has already occurred. In LA County, we surveyed more than 2,000 mandated reporters. And of those who admitted that they made a report to our child protection hotline when they did not suspect abuse or neglect, 65% of them indicated that making a report to the hotline is the best way to connect families to the services that they need. Mandated reporters must recognize that a third option of connecting families who are in need but who do not need CPS exists. And we have a responsibility to build pathways to facilitate those connections. Next slide, please. Actualizing this third option of connecting families to supportive resources when they don't need CPS requires organizational readiness for transformation. So this means the organization that employs mandated reporters must assess its readiness for this shift. In LA County, we are piloting our model of mandated reporting reform with a few organizations, and we are continuing to learn what it truly takes to move from mandated reporting to community supporting. We have found that although organizations may be very familiar with addressing family needs and capacity building, they're not connecting these two processes to mandated reporting because we've been conditioned to simply report or not report. A school counselor once told me that he had never considered service linkage within the context of mandated reporting because it's not packaged that way in the training. So in the next few slides, I will share with you some of our learning about organizational readiness for the shift. Next slide, please. The first and most important step in getting an organization ready for this shift to community supporting involves understanding the typical types of concerns that mandated reporters, right, your staff, have about families that lead them to believe that a report may be required. And once you know what mandated reporters are seeing, what your staff is seeing that's concerning them so deeply that they fear that a child may be at risk, you can begin identifying the supportive resources that may be able to safely address these concerns. And because this work in LA County is about promoting holistic family well-being, it's also important to identify other needs that a family may have, as well as the strengths that you can help to bolster. It's also critically important that organizations understand a family's needs from both the perspective of their staff as well as the families that they serve. So organizational readiness in this way, it requires engagement with the families and the communities that we serve. Next slide, please. So once organizations have a keen understanding of the type of issues and needs that are causing concern for mandated reporters, and they know the types of resources that may address them, they should begin assessing the availability of these resources. And questions that organizations may want to consider as part of this assessment include whether or not they provide the identified resources in-house. And if not, are these resources available in communities? Organizations will want to assess whether or not they have relationships with other organizations within their communities that may provide some of the services that families need. They may want to ask if they have or explore whether or not they have informal or formal partnerships, such as a subcontract or MOUs in place with agencies that provide the services that families need. And when it comes to considering the availability of resources, I really want to underscore the importance of ensuring that what is available, either through your organization or in community, is culturally relevant and culturally competent for the families that are being served. And the last thing I'll lift up on this slide is that when organizational leaders find that capacity is lacking, both within their agency and or within the community, they should be exploring strategies to build up and bolster the prevention and promotion ecosystem of services, supports, and opportunities that can be made available to families, again, when that family is in need but does not require an intervention by Child Protective Services. Next slide. And so the final lesson that I will lift up from my time with you is just to really speak more about the importance of building a bridge that will facilitate a mandated reporter's ability to connect families in need to the resources that are available either within the organization or through community partners. So there has to be a vehicle. So there has to be a pathway that's going to allow a mandated reporter to facilitate those linkages or referrals. And if we want mandated reporters to really use this third option that is available to them, right? So if we want that third grade teacher to link a family to supportive resources, we have to build processes that are as easy as it is to pick up the phone and make a report to a child protection hotline. So there are a few considerations that I want to lift up that should also be included in an organizational readiness assessment, and that's readiness for this shift away from over-reliance on the child welfare system towards community support. So the first thing that organizations should be considering is their training, policy, and practice. Organizational leaders should be exploring whether or not their mandated reporter training, policy, and practice norms speak to the importance of linking families to those needed supportive resources. So think back to what I lifted up about that school counselor who shared that he had never considered the two together. You may want to ask yourself, do you have decision support processes that are in place to help your staff determine when a report is needed based on state law, or when a family just needs to be linked to supportive resources? And there are times in which both may be necessary. There's no reason that a mandated reporter cannot make a report because they believe that there are some serious concerns and still connect that family to supportive resources at the same time. Organizations may want to explore the processes that they have in place for linking families to supportive resources. So do they exist? And are they simple? And do your staff know about these processes? Two school districts that we are partnering with here in LA County are using their counseling and case management teams as in-house service navigators, and they've developed policy and practice guidelines to support this. So when they use our decision support tool, and it helps them understand that a report is not required by state law, that the concern doesn't rise to the statutory threshold of making a report, our tool prompts them to link that family to supportive resources if they are in need. And these school districts are using their case managers and counselors to serve as navigators in that capacity. Another school district that we are, or another site that we're piloting with, is training their staff to use a combination of in-house resources as well as resources that are available through a resource portal that we developed in LA County called the Family Resource Finder. I do want to pause here and note that organizations must have a concrete plan in place for maintaining the accuracy of their catalog of supportive resources that they make available to staff for linkages to families. Many of you who've done this work before are well aware that that's no small feat. It's incredibly difficult to ensure that community-based resources remain current and up to date with the most accurate information. And agencies have to allocate and dedicate resources to maintaining this infrastructure. So it has to be a conscious action on the part of organizations that are seeking to make this shift. And it has to be supported by the resources that it'll take to get that done. And the last thing on this slide that I'll lift up is that organizations must also consider the best strategies to engage families in supportive resources. Of course, whenever possible, a warm handoff is always a best practice. We, in some of the agencies that we're partnering with, we have provided some light coaching to staff to help mandated reporters sort of take off that mandated reporter hat at this stage of the process and really just focus on the humanity of providing support to someone who's in need. Next slide, please. So in closing, I want to share with you about some of the tools that we've developed in LA County that are available for use by anyone who's interested. I think Min may have posted the link to our website in the chat. It's supportingfamilies.lacounty.gov. On this website, we have a training supplement on general neglect that's available. And if you are in California, this is state law and it's applicable to your work. And the decision tree that I referenced is also available on this website. You can also access the Family Resource Finder on the website. It is for LA County only, so the resources that have been curated and included in this portal are local to LA County. And then finally, we have an organizational readiness checklist that's available on the site for download. It includes some of the questions that I posed in this brief presentation, as well as other considerations that agencies should take into account as they're making the shift from mandated reporting to community supporting. And so now I will turn the floor over to Dr. McCroskey to close us out.
Well, first of all, thank you, Min and Tamara. As you can tell, both of these efforts are extraordinary in and of themselves, and both Min and Tamara do many other things. So Anna mentioned before that our first stage we affectionately call 1.0, and that was our first essentially 2.5 years of effort, and we're now moving to what we'll calling 2.0, and it's going to be under the combined leadership of Dr. Hunter and Ms. Meeker. So that makes me personally very happy and ready to keep this going. I just want to give you a little bit of a sense of what we felt were our achievements, challenges, and key lessons learned from, as I've mentioned, the first 2.5 years of work on Community Pathway. And I'll try to do it very, very quickly so you have time for questions and comments. But it was impressive that we could accelerate and coordinate efforts to get 27 pilot tests underway. I think I didn't mention before, while most of them were funded either through state block grant or technical assistance dollars or other dollars, philanthropic and other dollars, some were not. They were just about partnerships that needed to be established, et cetera. I think one of the things we all relied on at the beginning is that we have a strong home visiting system already in place in LA County, which is led by our Department of Public Health, First 5 LA, and there's a really strong backbone agency called the LA Best Babies Network, which has been doing a lot of the training, certifying, tracking of 3 evidence-based home visiting programs, which are all in our LA County plan and then in the state plan. So we were able to get off to a really strong start based on our partners' work to date. A lot of this work has required strengthening relationships that we kind of thought were already in place and establishing some new ones. Just one example of strengthening relationships that we thought were already in place. I still remember one of the phone calls I had with one of our partners at the Department of Public Health, who's very instrumental in the home visiting programs over there. And she said, I hear a lot of talk about how we're working together, but who do I call? And just at that level of who do I call? And do I know them and do they know me? We've done a great deal of work already and much more to be done. We were able to get off to a quick start for county government because we had some flexibility that was granted for the first stage of this. And in particular, we focused on interdepartmental transfers, which were not happening as much as they are now, and also work with philanthropy. We have a Center for Strategic Partnerships in county government that really facilitates the county's relationship with philanthropy. And we work very closely with the Southern California grant makers. And then the contracting issues. So we were able to do, because it's much quicker to subcontract than it is to issue new contracts, we were able to take advantage of some subcontracting opportunities. As you could hear, these are 2 very strong existing initiatives which were going on before and during the community pathway work. We weren't treating them as separate things. We were treating them as, how do we figure out the alignment between our efforts, between these efforts and many, many others. And the last thing in terms of achievements, I just want to talk about the fact, I think most of us know that there are changes going on in nearly every health and human services system in the state and at the federal level as well. And just focusing on one at a time is not going to get us to where we need to be when you have so many systems changing at the same time. When you have CalAIM, enhanced care management, and other things changing at the same time that we're moving from the mental health MHSA to behavioral health at the same time that First Five is developing a new strategic plan because of its new financial contraction. And how do we think about the systems, not just the programs, but the systems that support those programs? Next slide, please, Anna. Biggest challenges, I don't need to say much about because they're almost self-explanatory, but how do we sustain this work over time, given that we had a temporary funding available and that funding in most systems is decreasing. The need for families in our county to access concrete supports and basic resources is so much larger than the intention to enroll in evidence-based programs that has been a challenge and will continue to be one. We really need to think about how do we bring our funding streams together and the information sharing that needs to go along with that. Collaboration, clearly, inequity in county contracting. I just want to highlight that many of the local community-based programs that our families trust and know about, that because they are trauma-informed, culturally relevant, locally present, not necessarily present at the overall county level, those are the ones who are probably least likely to get county contracts. And so how do we address that over time? The places where we've got to bring the places that families know about and trust into that family of community-based services and supports that are going to help us make the opportunity for community pathway and mandated supporting and POSC and so many others a reality. I'm one of my hats I wear is as a researcher, and I know we're really far from being able to even articulate the key questions that we're going to need to track and understand over time. It's relatively simple to talk about the data elements that we need to report to the federal level for evidence-based programs for claiming, invoicing, and claiming. But it's a lot more complicated to bring together what the families really need, what's actually available in communities, and how do we get families to what they need in ways that make sense to them. Next page, next slide, please. I think I will. The only thing I'll say about this is that relationships, we all know, are very important. And here we're talking about personal relationships, individualized relationships. Who do I call? Who do I call? Will they answer my call? Do I know what they can do for the families that I'm working with? And I think that's the ongoing underlying work for all of us in building our community pathway. Anna, I think we wanted to try to leave at least a couple of minutes for questions and sort of next steps before we're done with this presentation.
Yeah, thank you. And thank you so much to my co-presenters today. Really just a wonderful group. And I feel very, very fortunate and humbled to be here with you and with all of you in our audience today. So because we had so many of you who responding to the Mentimeter that your jurisdiction is implementing a community pathway and you're exploring some partnerships and some key elements, I'm actually going to pivot a little bit because we only have a few minutes left. And I haven't had a chance to look at the chat since I've been sharing my screen, but I'm just wondering if anybody would like to come off mute Just raise your hand if you would, and just talk a little bit about your experience in your jurisdiction implementing a community pathway. Do we have anyone who would like to speak a little to that? Could be your successes, challenges. Is what we shared from LA County resonating with you? Do you have a different experience? Don't see anyone yet. I'm still scrolling. Still a minute. Okay, I guess in that case, we will start with clarifying questions. Does anybody have clarifying questions for any of our presenters today about what was shared? Again, you can just raise your hand. Okay, now I will go to the chat.
I have a clarifying
Thanks.
question. I'm sorry, I couldn't find
Yes.
the hand.
That's fine.
So it sounds like with LA County, the part in the state prevention plan where it requires entry into CARES and pulling down the match for Title IV prevention, that this community pathway is happening outside of that with other funding sources. I see Min nodding.
Yes, so the work that we're doing now for plans of safe care is outside of that. However, as you may know, the FFPS Community Pathways eligibility for Title IV funded services does include substance affected newborns and caregivers struggling with substance use. So when it becomes available, we are hoping that families that are referred to those services are able to draw, like DCFS and the shields for families or other CBOs that have these programs are able to draw down on 4E. Currently, what we are doing is referring families to services that are funded by Department of Public Health and 4survive LA for home visiting services. Our substance abuse and mental health departments are funding a lot of behavioral health, maternal health supports for families. So we are relying on a network of other services that are funded by the county departments that I listed.
Okay, thank you.
I think at the moment in LA, what we're drawing down is resources for training largely. And so we're at this sort of at this initial stage in administration, and very much hoped that we could go broader than that, but that hasn't happened yet. So that's why the emphasis on partnership, trying to make sure we understand what other systems or programs are able to pay for, and not assuming that a family is expected to navigate their way to finding all those things. But wherever you start, that place will help you to find the services and supports that you want.
I see a couple hands now. Carol and then Karen. I think we have, I'm not sure if they'll kick us out, but I think we have about a minute or two left.
I'll try to be quick. So my name is Carol Carrillo. I'm the Executive Director of the Child Abuse Prevention Council for Contra Costa. We do all the mandated reporter training in our county. And I'm so excited and anxious to get started on building a mandated supporter program in our county. I'm just wondering, is there a strategy that you all used in LA County to get the insurance, particularly the school insurance companies, to listen to the to making a change and listen to why it's important to not just report is what our school staff are told to do. And so we really want to try to make a shift starting with our school districts, but that's sort of our barrier, is how do we get insurance companies to work with us?
Yeah, thank you for that question. It's a challenge here as well. Uh, Fortunately, we were able to find a few courageous school districts who recognized that this approach to mandated reporting is in 100% compliance with the law And they recognize that well-trained and well-supported mandated reporters actually reduces their risk of liability. So we have a few courageous districts who we hope to see that, and they got it and saw the impacts that this can have on their families. I have had far more school districts share with me that they absolutely agree with everything that I'm saying, would love to do it, but. So in response to that, LA County, we in partnership with Assemblymember McKenna, introduced legislation into this legislative session. It's AB 970. It just made it into print, and it's going to allow us to formally attach the consequences and penalties that are associated with not reporting to our new model, so that those school districts who are still nervous, who are still worried, will have that psychological safety to try something different. So we believe that if we're successful with this legislation, that we'll have more organizations, school districts in particular, who are willing to partner and pilot this new model with us. The legislation is calling for a 2-year pilot in LA County. It includes an evaluation component. One of the components of the evaluation will be implications for other counties. So our hope is that if this is successful, it will lead to statewide change.
Great, thank you very much.
Thank you, Carol. Karen?
Hi there. Just a quick question around the community supporting mandated reporting and especially your work with schools looking for lessons learned. Like, have you had any concerns from the schools around their ability to resource, like, oh, that's going to be a longer conversation for us, or, you know, we have to apply more of a resource to that? I'm just curious if you've encountered that at all.
Sorry, we have not, and that's because the districts that we're partnering with are willing participants. In LA County, we have 81 different school districts. So the ones that are that we're partnering with and that are piloting our model want to be a part of this. And so they've been really creative in thinking through the resources that they already have at their disposal that can be leveraged for this. And schools and hospitals are among the most resource-rich organizations that employ mandated reporters. They just don't think about it that way. School districts all have student support services divisions. They have social workers, they have clinicians. They just don't think about it this way. So that's part of the shift that has to happen.
Lisa?
Hi, I'm from San Luis Obispo County. I serve as the executive director of the Child Abuse Prevention Council. And we were a key partner with our Department of Social Services to build our comprehensive prevention plan. This has been so exciting to hear about your bottom-up approach and also the mandated reporting strategies that you have to improve the system that is in place. But what I'd like to share is that I see here that Min put in that they're looking at CalAIM and CHWs to help advance this work. And we are doing the same thing too in our smaller scale here in San Luis Obispo County. So I just want to give a shout out to what is an opportunity to always is the concern about funding opportunities. And we're really I believe this is the way it's really going to make it happen for our small county, to make sure that these type of services like the navigators that you described would work in our hospitals. Fortunately, we only have 3. Thank you.
Thank you. If I could just respond really quickly, I would also just share that even though LA County, I think, you know, we have been using this bottom-up approach for POSC, we are also looking for legislative change. And, you know, I think there's a lot of opportunity to work at a state level to make some clear clarification through legislation on roles and responsibilities for hospitals versus child welfare around plans of safe care. So if any counties or partners here are interested, please reach out to us. Thank you.
Thank you. Nikki?
I just have a really quick question. I'm in San Diego County and we are creating an MOA with our schools to do something similar to this, to make this move from mandated reporters to community supporters. And I'm wondering, what we've heard as a concern is teachers not having the ability to provide resources to families directly. Are you working mostly with other staff like the school counselors, or who are you finding the most engagement with from the schools, or are the teachers also willing to make this shift?
Yeah, so in the school districts in which we're partnering are leveraging their LCSWs, their social work and counseling staff to serve as navigators. We also, and one district is using a hybrid model. So they're using some of their in-house support services staff and also that family resource finder portal that we created. I would encourage you all to take a look at that portal on our website because this is something that you can develop in your county. It's hosted on the One Degree platform, and you can create something very similar in your county that will make it easy for teachers, for example, to identify resources to provide to a family in need.
We should probably let folks go in the main session. Thank you so much. And thank you for all your questions and discussion, everybody.